next up is Rep. Martin with Families and Children Together. And so that is the request, Families and Children Together. Thank you for being here all day. I've seen you.
Madam Chair, thank you, and committee members. I'm here with Families and Children Together, commonly known as FACT. FACT's mission is to prevent families from entering the child welfare system, and for those already involved, to provide fundamentally different family-centered experience. FACT serves families across Genesee and Saginaw counties, reaching not only urban areas, but also rural communities where resources are often scarce. I have toured their Genesee County Community Service Hub and have seen firsthand the impact they have on families in my district and across Genesee and Saginaw counties. This request for $2 million would help expand this amazing program to impact families in the need of these essential services. And with us today is the Chief Executive Officer of FACT, Bridgitt McCaughey.
Hi, everyone. Bridgitt McCaughey, CEO of Families and Children Together, or FACT. We're a nonprofit community service organization with locations in Flint and Saginaw. Again, thank you for having us this evening, and thank you for that wonderful introduction, Representative Martin. Again, you know, it's about preventing the need for families coming into a foster care situation, or if they are in a foster care situation, how can we make that experience different? FACT was formed 4 years ago to meet the critical needs and fill gaps within communities to support families, devoted to strengthening the abilities of parents to keep their children safe and healthy and avoid the need for more expensive and traumatic interventions involving child welfare or foster care. We've done this by forming networks of community partners and organizations in Genesee and Saginaw counties. This allows our providers of existing services to come together in a coordinated effort to help with critical needs. Our network partners have met monthly for the past 2 years to share resources and develop strategies to support the needs of our communities. From the inception, we have partnered with Saginaw Valley State University, who provides our annual evaluations of FACT's work. They help us with informed approaches to planning and execution of referrals and support services. We have established neighborhood hubs in both counties, which are safe places where families from high crime and deep poverty can connect, reduce isolation, and have positive childhood experiences with their children. Since the first hub in September of 2024, we have served over 900 children and families across those 2 counties. In addition, multiple partner groups have used our spaces to provide direct services to families in one location. We help to meet concrete needs such as food, personal hygiene, rental and utility assistance, school supplies, and transportation issues. We host regular community events in both counties that bring families together, such as our community caregiver dinners, laundry days, and swim safe events. Specifically, this year we've hosted 15 community caregiver dinners, beginning with around 20 participants, and most recently we've grown to over 140 participants at one event. This allows children and families to have positive childhood experiences. We have provided concrete supports for nearly 150 families with children facing housing, utility, or transportation crises. And then finally hosted 10 community events that include community laundry days that provide a concrete support for families, as well as mobile Mondays which promote literacy. FACT is different. FACT works with other organizations to provide a coordinated, seamless response to helping families and children become stronger, more independent, self-determining, and self-sufficient. We focus on prevention, and existing resources is infinitely cheaper than government interventions that occur when families occur a crisis or even a catastrophe. We proactively outreach to the community and provide hands-on advocacy and help to children and parents in schools, with landlords and government agencies. We're not in the business of developing new programs, but rather working with our community partners to create new opportunities, positive experiences, ease of isolation, and community connections. Our ask today is for funding to continue to support our community collaborating efforts to positively impact families and children, and to decrease the potential for utilization of higher cost services. We know this is an effective model as evidenced by the ongoing research outcomes from SVSU. Our hubs are so valuable to provide a safe space for our families to gather and to coordinate services with other organizations. We've spent the last 4 years building trust and credibility within Genesee and Saginaw counties, where building trust is not easily earned, and we want to honor that trust by continuing our efforts. Ooh. So our model, we're looking to expand to the rest of the state, and we can build on the power of those community prevention services, strengthening families, and producing healthier and more productive youth and children.
Thank you very much. Do we have questions from the members? Okay, so the 2 million would just be to expand to the rest of the state then?
So it'd be continuing those operations and expanding into those rural areas. We've been asked by 2 counties to conduct an additional research to be able to work in those 2 counties, specifically Bay County, for example, in partnership with Great Lakes Bay Health, and Tuscola County, because resources are becoming more scarce and access to those resources is increasingly more difficult.
Okay. Well, thank you so much. Thank you for taking the time to be here today. I know it was a long day. All right.